All right, good morning, everybody, here to workshop number 16 in the World Health Summit. With this, I would say, very broad title, Planetary Health and Food Security, Earth Systems Change, Food and Health. And I think we try to cover here a broad range of topics in 1.5 hours. And have to welcome our panelists, which I will introduce in one of my next slides to you. And first, I will give you a short introduction. We are actually still waiting for one of our panelists. Hopefully, he will arrive in time to be here. So, what does it mean, health and Earth system in transition? So everybody thinks about, of course, climate change. There's more things which are going on when an Earth system changes. It's not only the climate which changes and the downstream effects. There are other things which change, and I think some of these topics we will probably touch too, but which includes biodiversity, loss of resources, and so on. However, I in my short introduction, I will actually focus especially on the climate change, because this is where we have the direct link both to food security and to infections. And of course, all three topics influence health. So the direct effect of the climate change on health. There's also a direct effect on the distribution of infections in the world. And of course, there is a direct effect on food security, and both infections and food security affect health. And there are a lot of different components which are important here, which influence that. Probably the most important thing is emerging infections, new infections, not only in humans and animals, but also in plants. And these infections are viruses, bacteria, and fungi and parasites. And I would like to mention especially the fungi, because we have a mycologist today here who actually focuses especially on this topic. We have the different changes in the environment. We have more drought, aridification, flood, erosion. There's not only loss of soils, but wildfires, which eventually lead to diseases, which heat-related diseases, dust, smoke-related lung diseases, and other comorbidities, which is important. And of course, we have also a direct effect of climate change is due to loss of crop. We have an increase in morbidity in the people. This means reduced productivity, loss of money, loss of land, loss of workforce, and of course, economic insecurity. And on the infection side, we have more vector-borne infections, more zoonoses. Waterborne infections will increase, of course, co-infections, because infections seldom come along. And other things, more difficult storage of vaccines and drugs when heat goes up. And we have, of course, on the food security side, we have the risk of undernutrition, which we have already now in certain places, especially under crisis conditions, but this becomes more and more prevalent. We have enhanced susceptibility to infections. I come to that in a minute. We have increased use of antibiotics, fungicides, insecticides, loss of biodiversity, which comes with that, changes in the microbiome, in the people, in the animals, on the plants, in the soils. We have more drug resistance, since there's a lot of dial use, and I think our mycologist will talk about that too, of fungicides, and the problems with food storage under these changing conditions, and the role of mycotoxins here. And in the end, basically, this will lead to enhanced incidence of infections, enhanced non-communicable diseases. Some of them often have an infectious origin. We have low resilience in the populations, in the end, mental health problems, conflicts, migrations, and so on. So I will quickly focus on the infection and food security side here, and the effect on health. And I dug out an old paper where we looked on undernutrition, which is actually caused by food insecurity. And this is a vicious cycle of which undernutrition is driving, where we have basically from malnutrition, impaired child development, compromised immunity, which leads to higher susceptibility to infections, to disease, to energy loss, not only in the individual, but in the whole population, reduced productivity, poverty, and then basically this starts on again through impaired education, health system, socioeconomic and political instability, and this basically is an amplifier to the whole system. I've just picked up a few examples. One example is when you look at children. I mean, this is known and has been shown in different studies and publications that under 5-year-olds mortality is due to severe acute undernutrition is associated usually with infections. And when you look at that, these are those with severe acute undernutrition. And the most causes are diarrheal diseases, HIV and pneumonia. And especially with the pulmonary infections, I think important is that the local immune responses are clearly impaired by reduced availability of nutrients and undernutrition. However, what is quite interesting that when you look at pneumonia, this is associated in children with a 4 times higher odds of death when they are severely undernourished. More importantly, however, this is not only with those children who are severely undernourished. We also see that in non-severely undernourished children, where you have an increase already in the risk of pneumonia and severe pneumonia, or in those which are moderately undernourished. So it's not only when you have really severe malnutritional conditions, it's already when it starts, when the crisis starts. And since this is one of my topic, this is tuberculosis. And this comes immediately into mind for those people who work on this disease, is when you compare here in these publications by Panisinia, where you clearly see an overlay of the tuberculosis incidence rates and, of course, the places where there is undernutrition in the world. And when you look at that, then it's pretty clear tuberculosis is a poverty-associated disease because it leads to poor nutritional status. This leads to weakened innate and adaptive immune responses, which usually leads to a reactivation of the latent infection. This is typically how tuberculosis arises. Many people are infected, probably 1/4, even probably of these rooms is a carrier of the pathogen without ever experiencing the disease during lifetime. Only in 10% it will break out under certain conditions. However, a pure nutritional status is one of those highly important risk factors here, and this is driven by poverty. And there is actually an experimental proof to that. So in these studies, which has been done in India 2 years ago, where they basically supported undernourished people under treatment against tuberculosis by supplement of food, protein-enriched food. And they clearly could show that by basically giving these people and leading to a gain of body weight, that the risk of severe tuberculosis in these patients is significantly reduced. Sounds very simple and sounds like it was probably 100 years ago, when people went into sanatoria worldwide to be treated against tuberculosis, is to give them good, important, healthy food, including protein food, milk, and so on and so on. And this, of course, at times without antibiotics, didn't help too much, but it helped. But these days, in the combination with antibiotics, this is probably one of the most important therapeutic supplementations. There's another thing when you look at into basically nutrition association with or undernutrition association with infectious, when you look at neglected tropical diseases. And the number of neglected tropical diseases are basically together, it's a bit difficult here, that they also overlie very significantly with places where you have more undernourished people. So in the end, this is probably what all this workshop is about. Everything is connected to everything else, like Alexander Humboldt told us when after he climbed the Chimborazo, not to the top, but he realized how in the world, from climate change, we come down to a human disease like tuberculosis, and that there are very strong links to it. And I think we have more links here when you think about the different topics we are talking about. And this is why I would like to introduce my panelists here. We have 5 impulse talks. The first will be given by Jochen Schanze, which he prepared together with Dieter Gerten. So Jochen Schanze is at the Institute, Leibniz Institute, and is important because it's a Leibniz session here, Leibniz Institute of Ecological, Urban and Regional Development in Dresden. And he's also the speaker of the Leibniz Lab Systemic Sustainability, which is one of the co-organizers. And Dieter Gerten, who unfortunately cannot be here, but he is at the Potsdam Institute for Climate Change Research in Potsdam, just around Berlin. Then we have a talk by Barbara Ammon from the Leibniz Institute of Agricultural Engineering and Bioeconomy, also in Potsdam. And she will talk about global food security and the role of livestock. And then we have the mycologist here on our panel list. This is Michaela Lackner from the Medical University in Innsbruck in Austria. And she will talk about from crops to clinics, how fungal pathogens endanger food and human health. And then we hopefully have, I think he's not here yet, Yadi Alsi on food and nutrition as development factors. He's from the Kofi Annan Foundation. And then we have, as the final impulse talk, Mary Muthoni Muriuki. She will talk on the dependence of health from food as an example from Kenya, and she's a specialist expert from Kenya, from the Ministry of Health and Public Health and Professional Standards in Nairobi. And then we have our discussion, which will be started by Malet Avoke. She's our postdoctoral scientist here, and she's not on the stage yet. And she's from the Leibniz Institute of Vegetable Ornamental Crops. Works on plant quality and food security, and she will give her impression on this workshop this morning. And with that, I will start. And here you have the people again, Barbara Ammon, Michaela Lackner, Yadi Alsi, Mary Muthoni Muriuki, and Malet Avoke. And with this, I would only invite you for the discussion afterwards, where we definitely will talk about the One Health approach and different types of actions points, which we would like to collect and maybe even put together in a publication afterwards to wrap up what we have discussed here. And with this, I would open the impulse talks and invite Jochen Schanze here on stage.
Welcome, ladies and gentlemen, dear colleagues. A great pleasure for me to contribute now with the first impulse talk to this workshop. As already announced, I would like to start the One Health perspective from a planetary view, focusing on interlinkages between food production and planetary boundaries, together with my colleague who has already been introduced, Dieter Gerten from the Potsdam Institute of Climate Impact Research. If we have a look at the global population, we still see an increase projected to reach 10 billion people at the end of the century. The daily food supply is unevenly distributed around the globe. Data from 2022 show that there are a lot of countries who cannot allow people to get the minimum average daily calories, 2,900 kilocalories a day. And of course, this means that there is a strong pressure on food production and the underlying agriculture in the future. If we compare this to the situation of the globe, then we need to admit that around 30% of the global loss in animal and plant species is caused by agriculture production, with a particular input from livestock and from irrigation crops. And also agriculture and forestry together are contributing 1/5 to greenhouse gas emissions. The change of the Earth system caused by agriculture at the same time come back to agriculture and food production. On the left-hand side of this global map, you can see how pollinator loss and heavily indebted poor countries affect economic development in the global north. At the same time, projected climate change will significantly affect many countries in the global south with regard to a reduction of crop. Now, this is already partly well known, and the Agenda 2030 for Sustainable Development has formulated a number of SDGs, and 3 SDGs are particularly focusing on food production. This is SDG 2, Zero Hunger, SDG 14, Life Below Water, and 15, Life on Land. And halfway of the Agenda 2023, we just achieved 15% of the SDGs, and with a particular poor situation for these 3 highlighted SDGs here, which are still face significant and major challenges to be addressed in the future. Now, if we complement this by a planetary perspective and include planetary boundaries, a concept which is referring to 9 Earth system processes that demarcate humanity's safe operating space, we see that agriculture is the largest single cause of planetary boundary transgression, affecting biochemical flows, particular nutrients, fertilizers, freshwater use, land system change, biosphere integrity. I already mentioned biodiversity. Climate change and novel entities is under investigation. And the recently published Planetary Health Check showed that now we are transgressing 7 of 9 planetary boundaries. So this means that in addition to the SDGs, we also need to somehow tackle with the planetary boundaries the limits of the planet as a finite system, and how we can address these. Now, studies of my colleague Dieter Gerten show that it's feasible, it's possible to feed 10 billion people within planetary boundaries, but this would involve that a combination of different actions is realized, particular decreased share of animal-based diets, reduce of food loss and waste, improve water and nutrient management, and relocate cropping and management system to less pressured areas. So it's possible, but we need to realize the actions listed here. And of course, then we could also respect planetary boundaries through avoiding cross-land expansion, halt of biodiversity loss, limit freshwater use and nutrient loads, and reduce greenhouse gas emissions. This now leads to the link between planetary boundaries and healthy food. The recently published Lancet report shows that based on a reference for a proper nutrition of the people, we are exceeding in some regions of the world this reference situation, and therefore our food provision and our nutrition significantly is interrelated with the planetary boundaries, and this needs a gross-scale perspectives, how our behavior, our food consumption, food production, food consumption are affecting planetary boundaries, and how can this be translated to actionable knowledge. And as my colleague Ulrich Scheible has already mentioned, then there is a clear link to the health topic, but this is up to the other speakers. And we are intending to frame this in one health perspective, trying to link the planetary boundaries to human health by a particular approach, by a systems approach. And therefore, the Leibniz Association is funding two instruments which are particularly relevant here. The one instrument is the Leibniz Lab Systemic Sustainability, where we try to establish new forms of collaboration across disciplines, a huge number of disciplines, but also involving societal actors in co-creation processes, to integrate knowledge to a systems approach, to understand things more clearly, but also to derive systemic innovations. And the image on the right-hand side from a paper which has been created by a working group established by IPCC, the Intergovernmental Panel on Climate Change, in IPBES, the panel on biodiversity. They identified that certain action can have positive, but can have at the same time negative effects on climate and biodiversity. Therefore, we need somehow to harmonize these things. And this is exactly what the Leibniz Lab is about. And of course, to improve science communication in a way that there's also possibility for societies to take up what science has proposed. And I'm very happy that we are also in strong collaboration with the Leibniz Alliance Infections, which has already been introduced before. And here we can create a link between the plant perspective, the food production perspective, and the health perspective. And with this, I thank you very much for the attention. Look forward to the discussion. Thank you very much.
Yeah, thank you very much, Jochen. And I think we have the discussion at the very end and just continue with our impulses and ask Barbara Amon on stage.
Yeah, a warm welcome also from my side. And I think we have heard two very relevant aspects that I might further work on in my talk. On the one hand, we heard that agriculture is responsible for quite some environmental burdens, but we also heard that how relevant nutrition is. So I think we need to bring both worlds together, sustainable nutrition with low environmental impact. We know that there are major great challenges. We already mentioned some of them, like the increasing consumption of livestock-based products related with nutrient losses, health risks, land degradation, water scarcity, greenhouse gas emissions, and agrobiodiversity loss. And we think that we need to find sustainable agricultural systems in a One Health approach that combine animal health, human health, and the environment. How can we do that? Well, first of all, I do think that our agriculture needs a paradigm change. So far, we consider the role of agriculture to produce food and feed for the world, and maybe also biomaterials. But we do think that this is not sufficient, because the role of agriculture is much more than that. We have health, we have water quality, we have climate protection, clean air. All these aspects need to be considered when we develop sustainable concepts for life, for agriculture in a One Health approach, because agricultural production is essential for global health. That is why we developed a vision for future agricultural systems. We do think that, as I said, agriculture is an essential part of holistic global health concepts. So when we develop such concepts, we should always integrate agricultural production. We want that agriculture produces the increasing demand of food, feed, and fiber sustainably and in partnership with nature. That is very relevant. We do believe that technologies can help, and we do develop digital and other technologies, but still we think that everything we do needs to stay within the framework of nature and to be done with partnership in nature. And we do have novel technologies that can monitor natural processes in detail and then mimic them to all our benefit. But still, we should stay within the partnership of nature. And that means that we need to close nutrient cycles, resource efficiency, through what we say is individualization, diversification, enabled by digital technologies. That means no more one-size-fits-all concept in monoculture agriculture, but really making use of the new technologies that we have for individualized and diversified concepts. We also think that, as you can see in the green cycle, livestock needs to become a new role within agricultural concepts, because livestock can be a part of sustainable and circular bioeconomy systems. But if so, we need to change the way we produce animals and the role of livestock in a whole system. For example, the FAO, the Food and Agricultural Organization, has recognized this some years ago. And I just come back from the Sustainable Livestock Transformation Conference that we held last week in Rome. And one of the initiatives there was a new document that we published that depicts the role of livestock in circular bioeconomy systems. And there you can find some key aspects how we shall frame and work with livestock in the future to really integrate livestock into circular concepts rather than having only very intensive livestock production apart from circularity and not connected with the region where livestock are kept. So what are the multiple roles of livestock? For example, livestock produce high quality protein from feed, which is non-edible for humans. That is sometimes forgotten, even especially in our Western world. But we do have many parts of the world where crops or plants or grassland is grown that we cannot feed humans with. So we need animals to transform these biomasses and resources into high valuable protein sources. We heard this, how important that is in the introductory talk. And the manure that livestock produce is then recycled as a valuable fertilizer to improve soil fertility and biological functions. And the grassland systems that we have around the globe do have a significant potential for carbon sequestration, and that is very relevant to mitigate climate change. But livestock has more than that role, also socioeconomic. We maintain rural areas and cultural landscapes with livestock. And it is, we should not forget, a relevant source of income, both in the EU and globally. And last but not least, if we integrate livestock and the number of livestock and the way we produce livestock into circular bioeconomy systems, then livestock does also play a role for biodiversity, specifically with the permanent meadows and pastures that contribute favorably to maintaining landscapes. I brought to you a picture from Uruguay. We also had a large conference there last year, and you can see how that high nature value grassland is maintained by the cattle. And Uruguay has done experiments. They removed cattle from that grasslands and they then turned into deserts because the soil is very thin. And if you do not have livestock to take care of these grasslands, then the landscape turns into a desert. But of course, as I said, in partnership with nature, the livestock density needs to be as low as these grasslands allow. So we cannot, for example, keep twice as many cows there. That would then be unsustainable. Livestock are more than food. They are recyclers by nature. Health and well-being. A very brief look at that. The FAO has started the initiative of the 4 betters. The better production, where we talk about sustainable consumption and production. We heard already malnutrition, but I would also like to draw your attention that we have areas of the globe where we have an overnutrition, and I think we need to balance both. That means we need healthy diets for all, a better environment through sustainable agricultural systems, and a better life. We may also not forget that it is about gender equality, rural transformations, and resilient agro-food systems. FAO also has a big initiative to reduce the need for antimicrobials on farms, and here they have the global target to reduce these use of antimicrobials. 100 countries participate in that initiative, and it is also very relevant that health workers from participating countries are trained to recognize diseases at an early stage, to prevent diseases, to survey them, and to only use antimicrobials if there's no other option. And finally, I would like to draw your attention to the need that we as scientists and we as a community, we need to work together in a stakeholder and policy support action. I brought some initiatives from the UNECE, the IPCC, and the FAO, and all these initiatives are very relevant and very helpful, the guidance documents that we produce there. But I also think that we need to work together. For example, if we, under UNECE, produce guidance documents to reduce ammonia emissions, we must reflect that also in an IPCC report, because these things must go together. Otherwise, the consumer, the farmer, the politician gets confused if he has different guidance from different bodies. And so the alignment of the different bodies is also very relevant. And that leads me to my final picture from the G07 meeting, the Global Environment Outlook, and my final conclusion that joint global action for a sustainable future is required. Thank you very much.
Yeah, thank you very much, Barbara Ammann, for this different aspects of the situation of food security in the world and the relation to agriculture. And now we move on directly, and this fits very nicely to the role of fungi in the environment and for health. Michaela Lackner.
Thank you very much. It's a great pleasure and honor to be here today. So I will talk from crops to clinics. I think fungi are an extraordinary example how we can actually approach this One Health concept. As you can see, not many people are familiar with fungal infection. Bacteria are way more in the spotlight than fungi. But I just want to show you some examples. So here we have a diversity of fungal infections that do not only infect livestock, but also wild birds and fish and also bovines. Fungal infections also affect trees, plants, crops, and flowers. And they even affect unlived nature around us, building structures and human environments. And I'm working at the medical university, so my focus is mainly on the fungal infections that do affect people. That can reach from fungal infections from the skin or from the nails that most people are familiar with, up to mycetoma, so infections of the feet that are deep-seated and have massive bone destructions, up to systemic infections of the lung and the brain. So if we look at fungi, then fungal infections actually impact on all these areas. So they infect all of the pets, livestock, wildlife. So in the last 2 decades, just to name an example, up to 250 frog and amphibian species have been extinct by fungal infection. So that really impacts on biodiversity. And biodiversity loss destabilizes ecosystems, and these obviously impact also on climate resilience. So we can actually stretch that whole bow from human health up to climate resistance if we look at fungal infections. Then they have major impacts on crop and plant health. They do affect humans, of course, and even our building structures. But as today I was only given 7 minutes, so I can only highlight 2 aspects. So I will put my main focus on human health and agriculture. So even though fungal infections are neglected disease, 6.5 million people are affected by those. And that number seems low, but if we compare it with bacterial infections, the death rates are even higher. We have 3.75 million deaths by fungal infections. That's due to a very high mortality rate that ranges between 60 and 90%, depending on the underlying disease of the patients and also on the area affected and the causative agent. And this problem also increases with fungal resistance that we observe in fungal pathogens. So we only have 3 substance classes that allow us to treat patients at the moment, and especially for one substance class that is used in dual usage, so that it's used in human veterinary health and also in agriculture, the azoles. We lose one of these very important restricted treatment classes. I will talk about this later. Also, WHO has shown that it's very important. So there was a fungal pathogen priority list released, similar to the bacterial lists a couple of years ago, and this was really a game changer for the field. If we look towards agriculture, we have estimated harvest loss of 20 to 40%. So 168 crop species are affected by fungal pathogens. That's pretty much a huge diversity of crops that we do see. So with these losses in crops that we do observe, we could feed 600 million to 4 billion people if we would produce more efficient. A huge problem is also contamination of crops with mycotoxins, which are 60 to 80%. And I will also show how that would change with climate change. So that's a huge proportion of food as it cannot be fully regarded as safe. And that impacts on malnutrition of people. And as a colleague already highlighted, we have the challenge of feeding 9 billion people by 2040 approximately. So I want to focus on 3 major challenges that we do see. So there is an increase of antifungal and fungicide resistance and also a change of pathogen factors in fungi. Major second point is mycodioxin production, and third, dual usage. So as we have heard, these global changes and impacts on interactions of plants and food, of fungi. So plants, if they are grown in less optimal conditions, they are more prone for fungal infections. And also fungal pathogens adapt due to the rising temperatures, and lots of the saprophytic fungi, so these are fungi that recycle organic matter, adapt to higher temperatures and can be in the future fungal pathogens of humans because they adapt to the body temperature of 37 degrees. And also the difference in land use requires more fungicide use. And then you think, well, we use more fungicides, so that helps us at least to contain the mycotoxin content in food products. But actually, that's a wrong conclusion that has been scientifically shown. So we actually get a cocktail of two bad things, fungicides and toxins, because lots of the fungicides put the fungus so much under stress that they produce even more toxins as if they would not be sprayed. Climate change highly impacts on the production of mycotoxin. Again, it's a stress reaction, so fungi do not thrive. And then we have also extreme weather events that favor the growth of fungi because they like it hot and moist. And so these mycotoxins then impact on human health significantly, either direct over food change with a major bad outcome of liver cancer, but also immune suppression and growth failure in children. And it also backs loop towards us via, for example, milk, if we feed the spoiled feed to cows. The third main big challenge that is my particular expertise is the dual usage of substance classes in the agriculture field and also in both medicines. So as I already highlighted, in fungal infections, we only have 3 agents classes at the moment, and ACEs are our global broad spectrum blockbusters. Therefore, they're also very popular in agriculture, and they're cheap as chips to produce. So obviously also economically very interesting. There's 2 more new substance classes in the pipelines that both are already used in agriculture and are currently in phase 3 studies in human medicine. So we have fungicide usage, over 99%, according to the last European reports, are used in agriculture. Human medicine and veterinary medicine account for less than 1%. And particular environmental hotspots are everywhere where we find these saprophytic fungi, compost heaps, and also other dead organic matter. That drives resistance in the health setting. And we have already elaborated on that. Also, the increase of risk group is the main driving factor that we see these fungal infections. So we responded to this agency report with a commentary and highlighted some major action points that we need to address to actually combat this problem. So we need a thorough evaluation of ASIL authorization and validation. We need monitoring data and usage data for ASILs in agriculture. We need to have a proper risk assessment on fungicide exposure and how to manage waste better. And then One Health surveillance and genomic epidemiological studies to actually see what's going on and what the resistance rates are, and try to avoid transmission and spread of these resistant fungi towards our immunocompromised patients. So this is my action list that I just highlighted on that graph. And I think it's time to join forces and collaborate, because it's very, very clear to us that One Health means not one antifungal. So we need to get all stakeholders on board and actually work on smart solutions that covers animal health, human health, and also environmental health. And to draw more attention and more workforce towards that, Paul Verwey, which is sitting here in the first row, a dear friend of mine, we both initiated this Focus AMR initiative, a Fungal One Health coalition for universal strategies to contain antimycotic resistance that is still highly overseen. So if you're interested in supporting us and join this initiative, please drop me an email, and I'm happy to take your questions.
Yeah, thank you very much. I think this brought a really important new aspect here to the discussion. And I then finally would like to introduce the regional perspective by Marie Musoni. And welcome to the stage. Thanks for coming.
A round of applause for him. He was afraid to pronounce my name wrongly. And he kept practicing from morning.
I've asked in the beginning. Okay.
Good morning, everybody. All protocols observed. It's quite an honor for me to join you this morning in this and to speak about the planetary health and food security. And I want to give you a context of where I come from, Kenya, which is basically a representative of probably the whole of Africa, what's going on. And in Kenya, planetary health is not just an abstract idea, but it is our daily reality because we live at the hard edge of climate instability, nutritional transition, and public health challenges. But we also stand at the frontier of solutions that are not just science-led, but also people-centered. And if you frame it into perspective, the health of our people is really inseparable with the health of our ecosystem. Because when you look at unsustainable land use, deforestation and overgrazing, disruption, rainfall patterns, which intensifies drought, flood cycles, and multiple health risks, then unsafe food production, checks in, and practices expose communities to pesticides, residue, contaminated water, and recurrent aflatoxin outbreaks, with one tragic episode in our country that claimed 125 lives in 2004. And at the same time, our dietary transition towards processed foods, which has driven a surge in non-communicable diseases. So in our country, if you look at 45% of women, 19% of men are either overweight and obese, and NCDs, 39% account for the deaths. Therefore, intensive livestock system, if not well governed, can amplify the zoonosis, antimicrobial resistance, and water contamination. These problems are not siloed because they are converging pressures. And the food security picture, if you look at it, today, 1.8 million people probably may face acute food insecurity that is projected to rise. But approximately 700, slightly more than 700,000 children and 100,000 pregnant women and lactating mothers may also face malnutrition. And this includes in far-to-reach counties in our country, the counties like Turkana, Mandera, Samburu, Isiolo, where critical malnutrition may affect. And climate shocks again interact with disease outbreaks, cholera, malaria, and diarrhea diseases, which strains the burden. But feeding and nourishing 55 million Kenyans under climate stress demands food safe systems that are safe, nutritious, equitable, and sustainable. So we don't sit pretty. We didn't sit pretty after all this because we know the problem. And I want to commend the leadership of the country that is aligning agriculture, nutrition, and health. And we have set a very decisive course to secure food and nutrition while safeguarding health and ecosystems. I want to commend my president, His Excellency, Dr. William Samoei Ruto, for his steadfast leadership in agriculture, food, and nutrition, and for championing the interventions with direct impact on human health. For example, we have the Galana Kulalu irrigation scheme, and this revitalization of Galana Kulalu has been widely praised for accelerating maize production to cushion climate shocks, creating seasonal jobs, and demonstrating climate resilience and water management. And equally, there is improved household maize access, stabilized local prices, and renewed confidence in Kenya's path to food sovereignty. We have also started distribution of subsidized fertilizer to our farmers just to ensure that the food system is all round. And our policy foundation, when you go to rights, primary health care, and One Health, Kenya's constitution enshrines the right to be free from hunger and to have adequate food of acceptance quality, and we are translating right into that reality. We have primary healthcare integration, the 831 community health promoters, people who are equipped with digital tools. They deliver household nutrition counseling, growth monitoring, and early referral. And their work is very basic. It is to check your blood pressure, blood sugar, remind mothers and caregivers that they need to take their children for vaccination, and also to remind the pregnant women, especially into the far to reach areas, that they need to go to a health facility for prenatal and postnatal. And we have come up with the laws, the Primary Healthcare Act of 2023, the Digital Health Act of 2023, the Facility Improvement Financing Act of 2023, and Social Health Insurance Act of 2023, because we couldn't do this if we do not have a base around primary healthcare. On social protection, again, with nutrition, we have our Inua Jamii, which reaches more than 1.2 million households, and the nutrition improvement through cash and health education program supports 48,000 households. That is combining income support and behavior change for diet quality. So again, cash transfers to the far to reach areas where they are also trained on how to grow their kitchen garden and improve on their diets. We also have the School Meals Program, which reaches 2.6 million learners, and with expansion of 10 million under a pledge that is improving learning outcomes, dietary adequacy, and local market linkages. Some of us, when we went to school those days, we had to carry food from our homes. And really, it was not very easy, because even getting that food was not easy. So you are expected to carry food, but there's still no food at home. So having food school meals program is really, really amazing. And to ensure that the learners we have improvement of learning outcomes. And food safety surveillance, which is strengthened monitoring for pesticide residues, aflatoxins, and microbial contamination, faster outbreak detection and response. And finally, we also talk about One Health and AMR stewardship, where we have our multi-sectoral coordination to ensure that this prudent antimicrobial use across human, animal, and the environmental health. We bring all our agencies together to ensure that we push this. Innovation of deploying AI sensors and data analytics for early warning systems, precision irrigation, and supply chain traceability and efficient climate-smart production. But why planetary health matters for every clinic, every classroom, every farm? Because planetary health is not a niche, it's the operating context for our clinics, our classrooms, and our farms. And in our clinics, if you look at it, nutritional services must anticipate climate-linked disease patterns, from malaria dynamics to diarrhea diseases, the surges after floods. And in the classroom, we have the school meals that are the foundation of nutritional and educational policy, and a platform for local procurement that rewards sustainable production. And to the farms, regenerative practices that save inputs and water stewardship, reduce environmental harm, and cut health risks and stabilize. We are building on the community health promoters who now use the digital tools to counsel on exclusive breastfeeding, diversified diets, and safe food handling. And also they flag malnutrition because we have trained them, we have kitted them, and we also have given them a digital gadget that makes their work easier to collect data right from the bottom of the pyramid. Again, the aflatoxin control is being mainstreamed through rapid tests, storage improvement, and extension services. And the AMR surveillance and stewardship expanding across all hospitals and veterinary services and aquaculture, and not forgetting the data platforms that are strengthening the risk of mapping. But what keeps us awake, and this is across board, any country, the citizens will think about the probability of a multi-year drought, food cycles, which may rise, and increasing the health system volatility. And of course, you're kept awake by diet-related NCDs that are encroaching the productive years. And these are the areas that in this room, we must be able to come together globally and see how do we curtail some of these issues. And market shocks, areas without governance. But our immediate priorities must always be scaling up climate resilience food production, make food safety non-negotiable. That should be the rider. And of course, embed nutrition in our primary healthcare. In our country, we have created 3 funds around primary healthcare. And the first fund is the Primary Healthcare Fund that takes care of the lowest level of facilities, the level 2, level 3, and level 4 facilities. Just in case anybody gets unwell, then they will be treated without necessarily getting money out of pocket. And we also have the Social Health Insurance Fund and Chronic and Critical Illness Fund again. This is an end-to-end coverage for every citizen in our country. I want to have a call to action to our partners in government, our partners in research, our partners in finance and civil society. Co-invest with partner states to scale irrigation and regenerative agriculture anchored in strong environmental safeguards. Number 2, support regional food safety hubs and portable diagnostics for aflatoxins and microbial hazards. 3, expand blended finance for cold chains, local processing, and biosecure livestock systems. And make sure that we back open interoperable data systems from the community health promoters to the markets to drive accountability and also the results. And of course, align procurement and trade standards with health sustainability outcomes so that safe, nutritious food wins in the marketplace. We need accountability and equity in all measures for our children, for ourselves, and for our women. It is important to, as I wind up, last season, a community health promoter from a very remote area called Turkana in Kenya used a very simple digital check to flag a child at risk. And the referral linked the household to a fortified blended food, safe water and guidance, and local sorghum producer participating in an aflatoxin safe aggregation. So the child recovered eventually. And this is not a miracle, ladies and gentlemen, because it is a system that is working. Health, agriculture, and markets aligned around dignity and data. Planetary health, ladies and gentlemen, is the ground beneath our feet and the air our children breathe. We are integrating nutrition into primary healthcare, strengthening food safety, expanding school meals, and applying One Health lens to protect our people and our planet. We thank everybody in this room for the leadership, and together, let us choose a future where every calorie nourishes, every harvest restores, and every policy protects both people and the planet. Thank you very much.
Thank you very much, Mary Misuni, and for this local perspective and this different, different things you already do in Kenya. And I think we have this also for the discussion. And therefore, I'm happy to introduce our young scientist here, Malit Aboke, and she will give us her perspective on what she heard this morning. Please.
Warm welcome, everyone, from my side as well, and thanks for having me. It was a very interesting talk, and yeah, I've learned a lot. And one speech stayed in my mind by Professor Urlich, the one by Alexander Humboldt. Everything is connected to everything else. That's what we have seen today. He have started by telling us how climate, food security, health, and infection are related. We can see the example that biodiversity loss, desertification, irregular rainfall or precipitation, which everything leads to food insecurity. And one of the examples, for example, that we have seen, children who are affected by malnutrition are 4 times higher odds of days by pneumonia. And also, there is another aspect that tuberculosis is poverty-related disease. So in order to address the health aspects such as tuberculosis, pneumonia, we need to increase the food security aspect and also reduce malnutrition. And in the next talk by Professor Johan, we have seen that how agriculture is both a driver, but at the same time a solution for food security and climate change. And in the next talk, we have seen by Professor Barbara that livestock, it can also be a solution, not also a problem, but we need to find a solution of a sustainable way of addressing food security and agriculture. For example, she mentioned that we can use manure application or organic fertilizer. And I have seen that for example, I did my research in Tanzania, and for a soil fertility, most farmers, they use organic fertilizer or manure application, and which is really important, which also addresses one of the agroecology principles, recycling. So we can see that we cannot separate everything. Everything is connected. In order to address health, we need to balance the agriculture. It's not that we need to stop productivity, but we need to start the way of how we do things. And another thing that I have seen is that there is enough, but there is no equal distribution. So we need to focus on the needs of the people in need. This I have taken from your slide, actually. Yes, I have seen it. So we need to focus on the need of the people in need. That means equity, inclusion, and also that I've liked the gender aspect from Professor Barbara. We need to consider women farmers in these aspects. For example, from livestock, they are mostly the one who is responsible when it comes to manure application. So we need to include those are disadvantages. So yes, we need to be more we need to include more stakeholders, not only scientists, but we need to include policymakers. We need to include the local ones, the farmers, because they are the one who is responsible for the production. They are the one who are affected the most. So we need to include them in the decision-making process. I've liked the case studies from Muriki as well. She gave an example from Tanzania. So yeah, Kenya, I'm sorry. It's East Africa. I'm sorry. Yeah. So the knowledge sharing, even among, she have give a good case examples. So we need to share this knowledge to other countries as well, involving local partners, local stakeholders. So yeah, like the one thing that stayed is everything is connected. For example, like the fungal aspects, we have seen that about 20 to 40% of loss of harvest loss from fungal infection, which can feed so many million people. And Professor Shanse also showed us that we need to feed 10 billion people. It's still possible, but we still need to be in the planetary boundaries. But how can we address that? So we need to think of a sustainable way of balancing and when we think of in production, we need to think how we can do it in a sustainable way. We need to think about inclusion, equitability, but also at the same time, how can we transform this to the ground? Everything is like in theory, but how can we take to the ground? How can we talk to the locals? And I like the knowledge integration approach. We can co-create, we can involve more policymakers, we can involve farmers, we can take their ideas. And yes, they are like, for me, they are like the most important people that we should include. And there should be more integration, transformation, and involving more local stakeholders. And yeah, thank you so much.
I invite you to the panelists. All right. So thank you very much to all panelists. Thank you very much, Malit, for your basically wrap up. You basically took the job from Jochen and myself at the end of the workshop, because you summarized it very nicely. But of course, we would also like to start discussion now with you guys. I would like, if you have a question, please tell us your name and quickly what you're doing, what your institution is you're coming from. And I've seen the first hand up here. Yeah. Mm-hmm.
And my name is Trinity. I'm originally from Jamaica, but I'm here with a youth group called Coalition Global Health Innovation. Thank you so much today for offering your expertise. I very much appreciate it. So I'm here to specifically address Miss Muthoni from Kenya. I would like to ask a question. Thank you. So I would like to address a phenomenon that is very common across the globe, but I would like to use Kenya as a case study to highlight the intersectionality between climate change and the spread of HIV among fishermen communities. So on Mfangano Island, Kenya, there's a high prevalence of the spread of HIV and AIDS, which has highly affected the male population, leading to many women losing their husbands. As a consequence, these women are having to go to the lakeshore at nighttime to sell their bodies in exchange for fish. In addition, there's a decline of fish in the lake due to fish changing their migratory patterns as a result of climate change and overfishing. The community has tried to turn to regenerative permaculture practices, but due to droughts, it has been difficult. So I would like to ask, what is Kenya doing to address these issues and assist communities that are experiencing these vulnerabilities? Thank you.
Want me to go? Is it done? Okay. Thank you very much for that question. And indeed, we have had a challenge around the rising cases on HIV and AIDS, and especially at the lake belt where the women are forced into sex for fish. However, as a country, we have been able to introduce many programs that are supporting women economically. Because if they do not have any support system, then they are not, that is when they go for sex for fish. Already we have partnered with World Bank on a Nyota program where we are targeting youths between the ages of 18 and 29. And those in PWD up to 35 years. And these are youths who have not gone to who have basic education. Therefore, they are just at home. Maybe they do not have money, and every of the youths will be given a certain amount of money. We will scale up their businesses because those are some of the programs that can align these women and youths at that early age. Again, we have a program on triple threat, issues to do with teenage pregnancies, diseases. And this goes among young girls and especially teenage girls who will go for sex for pads. And this goes across the country. It is ongoing, it is live, just to ensure that the girls also get to know their rights. They get to know why they need to equip themselves with skills that can not push them to that kind of probably immorality. And finally, we have been able to create the primary healthcare fund that is taking care of every other citizen at the lowest level of the facilities. And we are increasingly pushing for screening, early screening, whether it is in terms of non-communicable diseases. At the household level, we have our community health promoters ensuring that there's counseling that takes place should there be already a victim. Therefore, this we have seen is really expanding our scope in terms of reach of information and also ensuring that we are making these people capable and enhancing their way of lives. Yeah.
All right. Thank you. Are there more questions from the audience? Yes. Okay.
Hello, my name is Mark Wijn. I work for Access to Nutrition Initiative. We are an NGO in the Netherlands looking at the role of private sector in global nutrition challenges. And I was intrigued by the focus on undernutrition in the concept here. I was just wondering, because the conference here in Berlin talks a lot about how NCDs have become a bigger problem than many other diseases, and also in terms of diet-related diseases. So just wondering how the organizers, is that a deliberate choice, or do you also have a link with the problems linked to wrong diets and unhealthy foods? And I heard the speaker from Kenya mention already that they are very much aware of it and dealing with the problem of NCDs in Kenya by developing nutrient profiling models, etc. But just wondering how you try to bring this together. And if I may, one very specific questions on the fungi. I was also interested to hear, what do you see a link with the production of alternative food products based on fungi? Is there also risk there linked to infections, or is that too of a niche so far? Thank you.
Thank you for your question. I think let's probably start with the last one, and I would hand over the answer to Michaela Lackner.
So what do you see as alternative food, like soya beans? Fungi-based feed. So basically like mycosteaks and so forth. So that's actually quite a good question. So also fungi can parasite other fungi. So even in fungal food production, fungi do play a problem because there's also mycoparasitism, so that fungi also can infect fungi. But I think it's also a good alternative to lots of the other food base, because you can grow fungi in quite controlled environments. And as I highlighted in my talk, they're very good in eating up all the scraps that are not useful for a lot of other industries. So you can turn waste products that would otherwise end in a compost heap in actually producing nutritious food mass. Same we see also in the forests every day when we harvest the big mushrooms that are growing poletae and other nutritious fungi, and they are rich in lots of nutrients and minerals. So that's a good alternative as well.
Yeah, and I would probably start asking answering your first question. I think if we would include overnutrition, which is basically what you mentioned, we probably would have another session here in the same length and the same intensity. Just from my experience, this is why I try to avoid the term malnutrition, because this is actually both, over and under. But in this case, we try to focus on the food security factor, which is influenced by changes in the climate, and which is also importantly affected by fungi. I think this is why we focused on that. However, if you think about overnutrition and non-communicable diseases, then we probably would see the same picture. And in many countries, this is the problem. We have a current transition, I think, and this was Mari Musoni clearly mentioned also for Kenya, and this is true for many other countries, not only in the global south, that we, you come from the susceptibility to infection due to undernourishing, lack of micronutrients, which is also an important issue, which we haven't touched here, to an over-availability of food, of the wrong food, of sugar-containing food, and so on. And type 2 diabetes is a typical example, which also increases the risk of infectious diseases like tuberculosis. This is probably one of the other risk factors for gaining active tuberculosis is type 2 diabetes. And it is also true for other bacterial and fungal infections. Yeah? I think this is quite important to know, but would open a totally different workshop. Did anybody of you want to add?
I think I didn't really get the question right, but I think he's leaning onto the private sector. But in essence, what we need to do is to ensure that we integrate health metrics in any of the updates that we have, with clear baselines and targets. And of course, expanding the clean energy access to priority health facilities in our countries, and starting with high burden climate vulnerable areas. Again, strengthening of early warning, early action systems that is linked to meteorological data with health surveillance and community alerting. But that cannot be done alone. That's where the private sector comes in, with innovation and equally with financing. Thank you. I don't know if I answered your question.
No. All right, we have a next question. Yeah.
My name is Burkhard Komm. I work for a project on pandemic preparedness with the East African community based in Arusha in Tanzania. Professor Schauder, you mentioned very strongly the increase of population in the next 50 years. Africa will be disproportionately contributing to that, and hugely disproportionately contributing to that. That means also that food production in the African continent will have to intensify in a sustainable way, but very quickly, because population growth is also very quick. Are there any programs? Is there anything that FAO or researchers are doing in order to help the countries to come up with solution for that need that will arise in the next 10, 15, 20 years?
Thank you very much. Very relevant, highly relevant questions. And one additional point is that due to climate change, the situation gets even worse. So I would like to hand over the answer to my colleague, Professor Amon, because she is strongly involved in FAO discussions in this respect. Maybe, Barbara, you would like to answer?
Yeah, that is indeed a very relevant and very challenging question. And I only think that we can, as I tried to introduce in my talk, the 4 betters: the better production, better nutrition, better environment, that we really bring programs into those countries to improve productivity, improve efficiency, resource efficiency, and at the same time also reduce food losses. I think that is also a very relevant aspect, that we reduce food losses, because quite a lot of what we produce is lost during storage and transport. And we are definitely working on that, and I fully agree with you. And maybe I can also add another aspect related to your question and to the question we had before. I think lots of the environmental impacts, the negative environmental impacts that we have, is due to an overconsumption of livestock-based products. So it's not only an overconsumption itself, but mainly in livestock-based products. And I try to make that clear also in my presentation, that we need to have livestock in a circular bioeconomy, but we need to change the role of livestock, and we need to feed livestock on products that cannot be directly fed to humans. But on the other hand, that means that those products that we grow, for example, grains or pulses, that we feed that directly to the humans, because that is much more efficient in relation to energy conversion and also in relation to environmental impact. And I think that applies to the whole globe.
Yeah, thank you very much, Barbara. There's one more question, and this is probably all the last one for today, as I got a message.
Hello, I'm Yashasvi, and I'm a medical student from India. And I'm here representing IFMSA, which is International Federation for Medical Students Association. And it represents around 1.5 million students worldwide. So when I think about food security and biodiversity, sometimes I'm a medical intern. So like we just finished our community medicine postings. So there, like the patients and their attenders would come. So the most of the solution that we can like we suggest them is that you just focus on your daily habits and daily diets. That's how you can, like, come out of the problem. But I also feel that if topics like food security and sustainable relationship between the food and the environment, if it's included in the medical curriculum, it would make more sense for the health workforce that is coming out of the medical school to not only treat the patient based on the symptoms, but also to advocate for the sustainability between the environment and the health system. Thank you.
You? Any comments from you guys? I think this was also a good final comment to our session here. And I don't see any more. I think there are probably a lot more things to discuss, especially on the mycotoxins and the role of the mycotoxins. I thank you all very much for your contribution and your audience. I thank our panelists again for being here, and I would like to invite you for a quick for a quick picture in front of here. And maybe you can show the last slide again, also because this was the Leibniz workshop here for today, organized by the Leibniz Lab Systemic Sustainability and the Leibniz Research Alliance Infections. And you can, if you scan the QR codes, you can learn more about our activities here. And I think overnutrition is a problem, but I think undernutrition is still a problem too. And poverty is probably the biggest problem because it can contribute to both of it. And with that, I would close the session. Thank you very much and have another good meeting.